Hi everyone, my name is Erica and I am one of the injectors at Dr. Rudderman Plastic Surgery and Med Spa at our Midtown location. Today I want to discuss a case study of a lovely patient of mine in her 50s that just wanted an overall rejuvenation, and for her rejuvenation we did a combination of Botox and filler. I'm going to walk you through what areas we treated and why we treated them, and also common areas that we treat just to kind of enhance overall beauty of the entire face, and also just treat the natural signs of aging that I commonly see in a lot of my patients in their 50s and 60s, etc. First, we started with Botox in the upper face. She had fine lines throughout the forehead, between the brows, and around the eyes. The lines around the eyes are commonly called crow's feet. For the upper face Botox, our goal was to reduce the appearance of those lines, but also make sure she had a really nice, pretty brow lift and her eyes stayed very open so that she just looked more refreshed. So as you can see, we did a little bit of Botox in between the brows and a little bit on the upper forehead. With that, we just achieved a nice, subtle brow lift, and also the lines softened very nicely. With the Botox around the eyes, as you can see, her eyes just look more open because we really softened that muscle that closes the eyes tight. And you can also notice that the lines around her eyes are a lot softer. Now, with Botox, we don't just use Botox for prevention and line softening. We also use it for tightening, and we also use it for prevention of aging in the lower face. A lot of injectors don't talk about Botox in the lower face because it's not as common, but I think that Botox in the lower face is equally as important as Botox in the upper face. So for my patient, she was in her 50s and she did want a little bit of neck tightening, and she also wanted a little bit improvement in the jowl area. The first muscle we treated in the lower face for this patient was the DAO muscle. This is the muscle that is actually a depressor muscle of the corner of the mouth, meaning as we animate it, it actually brings the corner of the mouth down and it kind of creates that frowny mouth. So we did Botox in that muscle just to kind of kick the corners up a little bit. In addition to that, we have a muscle, a sheet-like muscle that wraps around the neck, and it's actually called our platysma. They create little bands that actually attach to the jawline and actually go all the way down and attach to our clavicle. When we animate this muscle, it actually pulls the jawline down. It's one of our depressor muscles. So by treating this muscle in this patient, it actually helped kind of tighten her jawline a little bit, but in addition to that, it also is preventing that sagging of that jawline over time because she's not able to pull that muscle down. In addition to those, we did a little bit of Botox into the skin, and I typically call that microtox, but what that means is we injected the Botox into the skin, not the muscle. And I commonly do that in the neck for skin laxity. Skin laxity meaning the skin starts to get a little bit loose and creepy. So for this patient, she was really bothered by that. So we injected it throughout that skin area just to kind of help tighten that skin a little bit. I think we achieved a really beautiful result in the upper face and the lower face with her Botox. As we age, there's different contributors to the aging process in the face. So we lose collagen and elastin in our skin. So because of that, our skin loses its natural elasticity and it becomes a little looser. In addition to that, we also lose bone density in the face, just as we lose bone density in our entire bodies. So we lose bone density in the cheek area, in the temples, in the jawline, in the chin, just to name a few. And so because we lose that bony structure, things start to kind of move downwards, and that's how we start to kind of notice that jowling. We start to notice the sagging along the jawline. We start to notice flattening of the cheeks and also a little bit of hollowing in the temples. So for this patient, we really wanted to address her entire face, and we wanted to just give her a very natural, pretty overall rejuvenation with filler. What we started with is she had a little bit of hollowing in her temples. So we added a little bit of droplet of filler into the temples, and what we achieved with this was we helped it reduce a little bit of that hollowing in her temples. And we also helped give her a really nice, pretty brow lift on the side. Now, not everyone has temple hollowing, and different people have different degrees of temple hollowing. So we really want to customize these treatments for you. And for this patient, she really just needed a little bit of filler there in that temple just to rejuvenate that upper face. In addition, she had good cheek structure, but she had lost a little bit of definition in that lateral cheek. She also had a little bit of flattening in that mid cheek, which we commonly see with aging. This is totally normal. So for this patient, we added a little bit of filler to her lateral cheek. And what this did was it basically replaced that lost volume that she had. And it also helped give her a really nice, pretty lift and nice contour to the cheek. With the mid cheek filler, some of her fat pads in the face had come down. And so we did a little bit of filler in that mid cheek just to give her that really nice youthful cheek and a nice contour to that mid cheek. As you can see in the photo, her cheeks just look a little bit more youthful. Then I wanted to address the mouth area for this patient. So a lot of us actually lose volume in our lips, and it can also be another sign of aging. Our lips just start to thin over time. So for this patient, she actually still had a lot of really good volume in her lips. So my goal wasn't really to add a lot of lip volume. She just had some fine lines and some really subtle signs of volume loss in her lips. So we used a product called Skinvive in her lips, which is actually a filler hydrator. It doesn't replace volume. The function of this filler, Skinvive, is to just hydrate the skin. So we injected it throughout the lips just to give her a really nice reduction in the lip lines and make her lips more youthful. And I think they turned out really beautiful. So for this patient, not only had she lost a little bit of volume in the cheeks and the temples, but she had also lost a little bit of structure along the jawline and in the chin. And what causes that is we lose bone density along that mandible, which is that jawline bone. And because of that, we start to lose support in that area. In addition, because we lose that structure, we start to see things moving downward. So we start to see kind of jowling and kind of pockets of skin and fat in this area, which bothers a lot of my patients, especially my patients in their 50s, 60s. Some of my patients even start to notice it in their 40s. So for this patient specifically, I wanted to restore that volume in her chin and also her jawline, just to restore that structure and to reduce the appearance of the jawline. So for the chin, we actually added filler to not only restore that structure, but as you can see with her profile, the filler in the chin really enhanced her profile and gave her a stronger jawline. And when you look at her from the front, you will also notice that the chin filler gave her a really nice, pretty, feminine taper to her chin, which changed the shape of her face a little bit, but it still looks very natural and enhanced, and it doesn't really look like she's had filler done, which is always our goal. After the chin filler, we added a little bit of filler to the back of the jawline. So we have a little angle of our jawline right here. It's called our gonial angle. It's where the jawline curves and comes this way. So she had lost volume back here in this area, and I really wanted to reduce the appearance of her jowling here. So what I did was I added a little bit of filler just as structural support to the back of her jawline to give her more jawline definition and to make that transition through her jawline more smooth and to make the jowl look less noticeable. These are actually the specific filler products that we use for this patient's overall rejuvenation. This product right here is called Skinvive. This is what we used to hydrate this patient's lips and just reduce the appearance of lip lines. As I mentioned before, Skinvive is not really a filler, meaning it doesn't replace lost volume. Its primary purpose is just to hydrate the skin, which is what I wanted to achieve on this patient. This product here in the middle is called Voluma. This is probably one of our most popular products because it actually lasts 1.5 to 2 years. And we primarily use this product to restore structure to the face. So we used Voluma for this patient's temples. We used it for this patient's cheeks. And we also used it in the chin just to add structure back to that bone area that she had lost over time, and to also help lift the lower face and lift that jawline area. And then this product right here is called Volux. This is actually one of our newer products in addition to the Skinvive. Volux is one of the largest filler supporters of the face. So it's kind of like a building block for the face. It's the thickest filler that's currently on the market, and it's really used for robust structural support. So this product is also going to last you about 1.5 to 2 years. We use this product for the back of this patient's jawline, and the jawline is where we commonly use this product called Volux. And this product just also added structure, but it just was a little bit more robust than the Voluma. So the difference between Voluma and Volux, Volumas and Volux are both adding structure and support, but the Volux is just restoring a little bit more volume than the Voluma is. As you can see, I think we achieved such a beautiful but natural result on this patient. We really just enhanced her natural features, and we added volume to where she had lost volume over time. When people look at her, friends and family, they probably can't tell that she's had filler done. It really just looks like she's a little bit more well rested, and she looks more like herself maybe 5-10 years ago. Our goal is to always just enhance your natural beauty, which is why we always want to look at the entire face and customize the treatment for you. Everyone has their own unique features, and everyone ages a little bit differently. So I hope this video was super helpful just to kind of get an idea of how we assess our patients with Botox and filler, and how we commonly use a combination of both to give you the most natural result possible. Thank you so much for watching, and I welcome you to come in for a consultation with us if you would like any of these treatments, or if you have any questions about any of these treatments. We would love to see you.